Today, events just like this one are taking place in every state and every territory across America to call policymakers to step up and take action for children. The investments that are being made by government officials for children on behalf of children's programming are falling at an alarming rate. So we are again here to urge America to step up and act for children. Did you know that spending for children at the federal level is only 1 cent for every dollar of non-defense expenditures? Did you know that from 1960 to 2006, the share of federal domestic spending for children has dropped over 23%? Did you know that only 1 penny of every federal dollar goes to support children's programming? At the state level, they have more responsibility for funding education and health care, and so their expenditures are somewhat different than at the federal level. However, adjusted for inflation, the non-healthcare and education expenditures in the state of North Carolina have declined over 8 years in a row. It's time for government to step up and act for children. What we need is reinvestment. We need reinvestment in the programs that we know work, like Smart Start, the Partnership for Children, like Children's Health Insurance, Health Choice, like Medicaid. We know these programs work. We need more investment in them. We need the state to raise revenues. We cannot keep cutting our way out of budget shortfalls. We need to raise revenues, and we need to reform systems in the state of North Carolina so things are more efficient and effective on behalf of children. We have with us today 4 experts that are going to talk to you about their perspective of how they want America and the state of North Carolina to step up and act for children. I am honored that the first one is Dr. Marian Earls. She is a pediatrician from Greensboro and the current president of the North Carolina Pediatric Society. Dr. Earls.
Thank you, Barbara. It's hard to follow musical talent. Those kids were awesome, weren't they? Pediatricians nationally and in North Carolina want all children to be insured and all children to have access to health care in a medical home. With the current budget crisis, that's not something that's happening regularly. All states are in that budget crisis right now, and unfortunately, in that process, children may be overlooked. We had a great positive step at the beginning of this year when Congress reauthorized CHIP. That allowed states to resume outreach and enrollment to get kids into their CHIP programs. That was called CHIPRA, the CHIP Reauthorization Act. And as wonderful as that was, and is, it's not enough, because we know it still doesn't get to all children. We have great expectations, however, from the federal health reform. The AAP has been giving clear and consistent messages to everybody in Washington who's working on health reform. And there are 5 priorities that I want you to try to remember. The first is that health insurance coverage should be given to all children, regardless of income, so that there'll be access to health care for all children. The second is that any insurance reform should have comprehensive, age-appropriate benefits for children, whether it's in the private insurance market or in public insurance. And the reason for this is that kids aren't little adults. They have their own health needs and their own standards of care. So the AAP is asking that any benefit program would be consistent with the AAP's Bright Futures expectations for children and with what EPSDT at the federal level has always asked for children. The third is that care would be delivered in a medical home where care is coordinated between the primary care physician, the specialty physicians, the hospital, emergency, and includes the family in that process. The fourth is that all children should have access to pediatricians and pediatric specialists. And the fifth is that these needed services are assured by appropriate payment. In many states, where payment for these services for children is so low, even when children are insured, it's hard for them to find places where they can get access to care. So these are the 5 priorities. Health insurance coverage for all, comprehensive age-appropriate benefits, care delivered in a medical home, access to pediatric subspecialists, and adequate payment for services so that children aren't left out from being able to receive services. We are very hopeful that these things will come to fruition in our federal health reform. Again, we've been giving consistent messages from the AAP, and our president, Dave Taylor, who's a North Carolinian, is at the White House today talking about health care reform and driving that message home that we have to keep kids in mind. We're hopeful that all kids will be a priority in the health care reform, and I encourage all of you to let your legislators know that that's something you want for children too. Thank you.